Well, we asked the Department of Health for an interview, but no one was available. So I'm joined now by Dr. Roshana Mehdian, who's currently working as an orthopaedic registrar. 11% pay offer must sound pretty tempting, doesn't it?
Well, I'm glad you brought that up, but I'd just like to make clear that this isn't a pay rise at all, not in any shape or form. So there's been no change in the pay contract for the basis for the contract. All Mr. Hunt has done is offer us a bribe.
Well, the Department of Health says that it will be a pay increase for 75% of doctors. I mean, we don't have them here to challenge them on that, but that's what they're saying.
I've actually looked through this contract with a friend who is an employment lawyer. So she's looked at the details with a fine-tooth comb. All this is a bribe for the next few years for us to ignore the concerns about patient safety and fairness.
If it's a bribe, you accept it's a pay rise?
No, it's not actually. What it seems to be is an assurance that our pay will stay the same for 2 or 3 years, and then the contract that he's been wanting to impose over the past few months will come into force. And I'm afraid doctors will not take bribes on this.
Do you accept, whether you quibble with the figures, but do you accept that the new contract is to support a 24-hour, 7-day NHS, which is what the government points out was in their manifesto? Do you accept they have a duty to deliver on that?
We all have a duty to deliver on a 24-hour, 7-day emergency service, which we already do. I, for one, and all of my colleagues already work 24 hours a day, 7 days a week. I work Saturdays and Sundays. Mr. Hunt is misleading the public when he says this does not happen, and actually it's having detrimental effects on patients. He
says the BMA is misleading you. Do you feel misled by the BMA?
Not at all.
So the fact that the BMA refused to talk to the Health Secretary, I mean, you can't lay all the blame at the government's door, can you, here?
Well, I don't think that's true. They haven't refused to talk. What they've asked is, consistently, they've asked for negotiations, and meaningful negotiations, where a gun isn't held to their head. At the moment, Mr. Hunt wants to impose the contract and will not budge on 22 of 23 points. That's not a negotiation in my book, and I don't think it's a negotiation in most people's books.
But the fact remains we're in a sort of Mexican standoff here, and the risk is that patients are going to end up losing out. I mean, at the moment, I would say doctors are pretty trusted, but if you go on strike, there's a risk you're going to lose that trust, isn't there?
And that's why we're happy to talk. We've always been happy to talk, unlike Mr. Hunt. In fact, in the next few weeks, we're going to go out onto the streets and speak to patients and the public ourselves. Mr. Hunt isn't doing that. All he's doing is giving you covert messages overnight and not to ourselves or our representatives and spinning it to the media.
So what would it take for you to talk to the Health Secretary?
We've been asking for the same thing for months, and that is assurances on patient safety, first and foremost, assurances on equality for women who take maternity leave and cancer researchers, etc., and assurances on a fair pay deal for doctors.
Dr. Roshana Mehdian, thank you very much for joining us. John.